Okay, our group has red yeast rice, the herbal supplement, over the counter, most commonly found at CVS, Walgreens, or any other dietary supplement store or section. It is white rice fermented with red yeast. The most common indication for red yeast rice is for hyperlipidemia. It's an anti-lipidemic. This is due to the monocolin K content. Monocolin K has the same chemical structure as lovastatin, and as shown in the diagram above, through a couple different reactions, it can be switched to other similar statins that work on blood cholesterol. Monocolin K affects cholesterol low-density lipoprotein blood serum levels, which is commonly known as the bad cholesterol. Through daily use of red yeast rice, LDL levels can be reduced within 15 to 25% within 68 weeks of daily consumption. The common dose of red yeast rice is an oral capsule, 600 milligrams to 600 milligrams once a day, which is a total of 1,200 milligrams. If you are ingesting non-formulated capsules, as in regular red yeast rice, that is equivalent to 2 cups a day.
Okay. For the effectiveness of red yeast rice is directly correlated with the monocolin K content up to 10 milligrams a day. The problem with measuring the effectiveness in this herbal supplement is that it varies even with the dose of commercially available products. So you can't gauge how effective it will be based on how many tablets you're taking. However, it works really well for patients who have an intolerance to the prescription statins. It does need to be taken with clinical oversight, even though it is an over-the-counter medication. It has also been shown to be effective for HIV/AIDS-related high cholesterol. It can also reduce the severity of heart attacks. Studies are being done to evaluate the effectiveness of its antibacterial, antioxidant effects, along with its impact on the central nervous system. So far, there has not been any conclusive evidence in clinical trials for these indications and their effectiveness. The FDA has issued warnings in 2007 and 2013 because there was lack of evidence for its effectiveness to lower cholesterol.
All right, red yeast is generally considered pretty safe, but as with any other medication, there's always some potential risks and side effects. There's a potential risk if you take it with alcohol and grapefruit, so it's not recommended that you do that. You also shouldn't take it if you're pregnant or planning to become pregnant. Some common adverse side effects would be abdominal discomfort, diarrhea, dizziness, headache, and heartburn and nausea, among others. If you experience any of those side effects, I would just stop taking and contact your doctor right away. And then some serious adverse side effects, although rare, would be hepatotoxicity, which would be liver damage, renal toxicity, which is like kidney damage, and then rhabdomyolysis, which is proteins damaging the kidneys and is characterized by red or dark urine.
So there are some drug interactions that are associated with red yeast rice. The first one is cyclosporine, which increases plasma levels of lovastatin by 5 to 20 times and increases the risk of myopathy. Because red yeast rice already contains varying amounts of lovastatin, taking it in addition to other HMG-CoA reductase inhibitors or statins can cause therapeutic or supratherapeutic levels of lovastatin in the blood. Taking red yeast rice with high doses of niacin or with the drug gemfibrozil can increase the risk of rhabdomyolysis. And research has shown that red yeast rice can increase liver enzyme levels in some patients. So taking red yeast rice, other hepatotoxic drugs should be avoided to prevent liver damage. Cytochrome P453A is responsible for metabolizing lovastatin. So taking a CYP3A4 inhibitor in addition to red yeast rice may result in increased serum levels of lovastatin.
Convenience. Red yeast rice is commonly sold as an over-the-counter supplement marketed to help manage cholesterol and improve overall health. Also, it can be found in online stores at convenient price with free shipping. Red yeast rice is available commercially, primarily as 600 and 1200 milligram capsules, tablets, and powder. Suggest dose is take 2 capsules, 600 milligrams by mouth daily for the total dose 1200 milligrams a day. Red yeast rice has the effect of lowering cholesterol levels. Since cholesterol production takes place in the liver mainly at night, it's best to take red yeast rice before going to bed in order to obtain maximum benefit. So store the product in the cold, dry place away from children and pets.
To summarize the info in this presentation, red yeast rice is indicated to be likely effective for hyperlipidemia. And some key counseling points are that this can easily be obtained over the counter or through online websites. Avoid taking this supplement if you're pregnant or if you're planning to become pregnant. And also avoid taking drugs that are classified as statins with the supplement. If you experience any symptoms of hepatotoxicity, which is like liver toxicity, such as jaundice, abdominal pain, nausea, or vomiting, make sure to seek emergency medical care immediately. Also, take these capsules with food to minimize any side effects and avoid drinking alcohol while taking the supplement. And as always, consult with your provider before beginning and while taking the supplement.